The number of women who suffer from eating disorders is on the rise, particularly among minorities, and it appears the pandemic is a contributing factor as well. Why? And what can be done to help solve the problem? That's the topic of this week's in-depth conversation with moderator Susan Cadot and her guests.
Thank you, Rich. Eating disorders are a serious topic that affect everyone everywhere, all over the world, and we have some wonderful experts here to give us some input and some insight into this issue. I'd like to welcome our panelists with us today. First, we have Dr. Joel Jaros, who is the Chief Medical Officer at Monte. And then we have Jacqueline Akon, who is an LPC and President of Eating Disorder Hope and Addiction Hope. I'd like to thank both of you for being with us today.
Thank you.
Thanks. It's great to be here.
All right, Doctor, I'd like to start with you. Tell us what your organization does.
Monte and Affiliates is a nationwide program for treatment of eating disorders, specifically anorexia nervosa, bulimia nervosa, and binge eating disorder. So we have multidisciplinary teams in all locations that we're in. I think it's now up to 31 programs in 13 states.
That's wonderful. And Jacqueline, how about yours?
Eating Disorder Hope's been around since 2005. It's an online community that provides information and resources and treatment referrals for people dealing with eating disorders.
What is the website for that? Let me go ahead and get that real quick. As people listen to our conversation, they can be checking that out as well.
Thank you. Eatingdisorderhope.com.
Eatingdisorderhope.com. Okay, thank you. And Doctor, do you have one you'd like us to put out for yours?
Sure. Monte, M-O-N-T-E, Nido, N-I-D-O, and the word affiliates with an S.com.
This is an important topic, and I want people to have access, who are listening to this, access to help that they need. What is an eating disorder, Doctor?
Well, it's a formal definition for through the Diagnostic Statistical Manual. Those are very clear. They have multiple different points that the person must meet in order to be categorized as one eating disorder versus another. And then there's a little catch-all definition as well. But so many people out there will come up to me and say, boy, do I need your help. And they always are talking about compulsive overeating. And compulsive overeating is not a classic eating disorder.
Jacqueline, for you, what is an eating disorder? I understand it hits pretty close to home for you.
Sure. Well, as Joel mentioned, there's anorexia, bulimia, and binge eating disorder, the top ones that we treat. There are others outlined in the DSM-5. For me, I struggled with an eating disorder for many years that really ripped apart my life and my family. And when I finally went into treatment at 28, I got it kind of back together and went back to school, became a therapist, and started Eating Disorder Hope. So my painful experience with eating disorders gave me the opportunity to do good in the world.
Eating disorders have been around for a very long time, but since 1980, we've really made advances in the field. Talk about the history and what really brought the disorder to the public eye. Doctor, we'll start with you.
Yeah, it's evolved a lot over the past 20, 30 years. I started in this field 30 years ago, so I've seen the changes progress considerably. Used to be institutionalization, mixing individuals with other mental health patients in facilities, forced feeding. Those are not conducive to healing from an eating disorder, those kinds of things. What we've done over the years is, separated this out and focused on the eating disorders we treat specifically, and bring in the team members, all the different members, nutrition, therapists, psychiatrists, medical physicians, to take care of these individuals. And we think that we have seen some pretty good outcomes by doing that over the years.
Jacqueline, I want to come to you. I know you probably interact, and you've been through this personally, but you interact with a lot of people. How do you tell someone really has a disorder?
Well, there's symptoms, and we outline these on Eating Disorder Hope for bulimia and things to look for. For example, if you're suspecting that your child or a loved one has bulimia, you might notice that they're missing for periods of time after a meal, that there's markings on their fingers, that they have swollen glands, dehydration can be some signs. But usually the way someone lets you know is they come and they tell you they're really troubled about their eating and their body, and they're confused and they're hurting about it, and they want to feel more holistically integrated and not strewn apart by dieting and weight and things that are causing them pain.
What do you mean markings on their fingers? What is that?
If in bulimia, self-induced vomiting can cause marks on your knuckles.
From scraping against the teeth when you're inducing purging with your finger.
So it's happening that often that it would?
Oh yes, I've had clients, sadly, that purge 12 times a day.
Yeah.
Oh, right.
It becomes an all-consuming thing.
Wouldn't the acid be a health detriment to the esophagus, the teeth, the mouth?
Very much. Yeah, those individuals that purge frequently like that risk anything from cavities of the teeth to esophageal cancer. So we need to screen those people carefully for other things that can be secondary to the eating disorder.
Is this simply a mental health issue, doctor?
No, not at all. In fact, eating disorders are one of the few things that I can think of as far as diagnoses that cross that spectrum between emotional and physical, medical and mental health. So, we have to be very alert for all of the medical complications, although it is a mental health diagnosis.
What kind of triggers it, though? Can it be, you can have two people who grow up in the same environment. One has an eating disorder and the other doesn't, but they've grown up in the same environment. So what are triggers? And I'll let each of you answer that you've seen or heard from clients or patients.
I would say what I've heard frequently from doctors is that genetics kind of load the gun and the environment pulls the trigger. And what they mean by that is we've learned through studies, we need a lot more research and we need more funding for it. But what we have so far, we've learned that there is a genetic predisposition to eating disorders, also often underlying depression, anxiety, things like that. And then environment can be so many factors. It can be the media, it can be the culture, it can be the upbringing of the individual, and that continues to evolve. What do you have to say about that, doctor?
Well, it's so fascinating because a few years ago, we started getting into the genetics like Jacqueline is talking about, and they've actually gone right down to the genetic coding on the chromosome and identified locations on the chromosomes that are consistent with the eating disorder diagnosis, and that's one part of it. There are other factors that come into play, such as sociocultural factors. Somebody mentioned something about their body shape, or a loving father might call his kid chubby in a term of endearment, which really sticks with them for the rest of their life. Worse yet, there can be things like trauma, rape, incest, things like that can be very deeply rooted. And if you don't get to the root of the problem, you don't get to the cure for the eating disorder.
Is it a control issue as well?
Yeah, I would say life becomes so chaotic with an eating disorder that these individuals will try and find any means of trying to control their life. And sometimes that comes down to food. That's an easier thing to control than anything else. Jacqueline may have another perspective on that as well.
Thanks, Joel. I would say, just in recovery from an eating disorder, I am what they might call a control freak. And I've worked on it over many years with different skills to accept life on life's terms. And so that's something we often strive to work for in people with eating disorders, is to allow life to happen and not be hijacked by it.
I understand that historically eating disorders have been in the domain of white heterosexual women, but that is changing. Am I right, Jacqueline?
Yes, very much so. In fact, interestingly, a lot of men develop eating disorders, and there's a little bit of a misconception that it's not heterosexual men. What the most recent stats I've read are about 15% of men that are gay struggle with eating disorders, and the rest are heterosexual. So we're working hard to bring attention to male eating disorders and the factors behind that. Also, the LGBTQ community and people of color are underrepresented in treatment, but struggle with the eating disorders very much.
And is age a factor in this?
Yeah, it spans the age range. I mean, the youngest patient I've ever had was 7 years old. and the oldest one I've ever treated is 75 years old.
Wow.
So, and the 7-year-old, by the way, had to have intravenous fluids because she wasn't eating or drinking anything. And she asked me about everything that might be in that bag of fluid, including how much sugar was in there.
Why? How does a 7-year-old get to that point?
I think there's a lot of modeling out there in society. If you look in the fridge, and in this particular case, by the way, the mother had an eating disorder as well. Mother didn't want treatment, so we focused on here's what you need to do for your child, and that kid made a full recovery within 1 year. But you have to look and say, what does your home environment look like? What's in your fridge? Is it all diet foods? Do you eat together, or is the mealtime fractured? So many different factors that come into play with it.
Wow, so you're saying the family meal around the table could help?
Yeah, it's not the favorite thing for a person who struggles with an eating disorder because they don't like to be watched with their eating habits a lot of the time. However, early on as a preventive thing, I think it's very important to get into that. And we also teach that or help individuals go back to learning that with treatment.
Jacqueline, I want to come to you real quick. What are the consequences of having an eating disorder for someone who has it? What does the world look like to them?
Well, first of all, they're going to have physical consequences, and they can be, pretty severe. You can have gastro issues, you can have neurological issues. Additionally, quite frequently, someone with an eating disorder isolates, pulls away from relationships, is less active, maybe in social engagements, school commitments, things like that.
Okay. What do you see, doctor, in that arena? What are some of the common issues in the world that these folks face?
Yeah, well, there's so many. I mean, they can become all consumed, like Jacqueline was talking about purging continually. They lose their work. They have to check out of school, focus on this. But the other things would be, serious problems over time, like bone loss and bone fractures, heart problems, kidney problems. The brain shrinks down in size over time. They don't think clearly. And if you reach that point of no return, it's obviously, it's a very end stage at that point.
So here we go. Let's say you have a loved one. If it's not yourself, it's a loved one, and you don't know how to help them. What can be a first step toward getting them to get the help that they need? And I'll let either one of you answer that.
You can start, Jacqueline.
Thank you. I would say going to that person and expressing what you're observing, that you care, and that you'd like to help them get support if they're open to that.
Yeah.
What if they're not, doctor? Do you just drag them in?
I think it's absolutely, well, kids, it's an entirely different thing than adults. Kids don't have that ability to say, no, I'm not going. You need to, and the other thing is you have to reach them during that growth window, or they can suffer permanent problems by not growing and developing properly. So kids, it's a different ballgame. They have to go in, they have to be evaluated. Of course, how we do that is what's important, and try and bring them on board and develop that trust factor with them. With adults, you do try the same thing, develop the trust factor and help them understand what the ramifications are with this. And then sometimes we do use medications to help treat some of their depression and anxiety.
So something that's unique, besides the overall growth patterns that you've seen, doctor, in the past year, everyone's been quarantined at home. Do you think, doctor, that has an impact on folks with eating disorders? Are they able to, you expect to see a growth in folks seeking treatment now that the quarantines are lifting?
Well, I will tell you this, we've never been busier. I mean, programs are full and waiting lists extensive. So I can tell you that the COVID epidemic did impact things. There's no doubt about that, and not in a positive way.
So Jacqueline, when you're looking at recovery, what made you take those steps to get out or to fix the issues that you were facing? What did recovery look like for you?
Thank you for asking. So, it was pretty, I was struggling. I looked like a kind of an achiever at that point in my life, but behind the scenes, I was consumed with bulimia and instability in my personal life, but always trying to do well in the world. And I finally got to the point where I was so desperate and fearful for my life because of all the electrolyte imbalances and things from the bulimia that I admitted myself to a 30-day treatment program back when I was 28. I'm 55 now. And just doing that alone, in my case, was life-changing because it interrupted the behavior, got me some therapy, got me hooked up with a good therapist, nutritionist long-term, and then I was able to turn around my life in so many ways. I mean, there's so much hope behind or ahead of the suffering. So it can be a stepping stone for a very good and productive life.
I would also give a message to those individuals that have been struggling with eating disorders for years and years. Maybe they've been in the hospital 10 different times. My own sister almost died of anorexia nervosa, and it wasn't until age 46 that her life was almost falling apart, and she agreed to get into treatment, and she made a full and lasting recovery at age 46. So it's possible.
That's wonderful. That's hope and light at the end of the tunnel for folks who may be walking this journey alone. We don't have much time left, so I'd like to get final words from you, Jacqueline. What are your final words to people out there who are hearing you right now?
I would strongly encourage early intervention for eating disorders. Research shows that the sooner we treat it, the better. And I also strongly recommend seeing individuals that are clinicians that are trained in eating disorders, starting with a nutritionist and therapist, and then going on up to intensive outpatient, partial hospitalization to full residential or inpatient if need be.
Great. And doctor, you get the final word.
Well, eating disorder treatment has never been better. I will tell you, there are new therapies that have come out that we're utilizing. We try and match what works to the individual and really tailor and personalize treatment for the individual. And I think that is probably the single most effective thing that you can do. So there's a lot of hope out there, and we're moving that way more and more.
Wonderful. I know there's more we could get into. I'd like to thank both of you, though, for the time you've taken to give us this insight into this disease and this disorder. And hopefully we've reached some folks out there who needed to hear what you had to say.
It's a pleasure. Thanks.
Thank you, Susan.